welcome to Med Cafe. This is our very first episode and we're delighted to have our amazing guest Jade Lopes here to talk to us about GP. So Jade, first question for you, will it be tea or will it be coffee?
Tea, please.
Okay. Wow. Okay, so do you want to tell us a little bit about yourself, Jade?
Sure. So I'm Jade Lopes, as you said. I'm a fourth year medical student at the University of Leicester. And this year I'm the president of the University of Leicester GP Society. I live in Leicester with my really cute Japanese Shiba Inu Mochi and my husband.
Excellent. So how did you get involved with being president of GP Society?
Oh, so I guess it all started with third year primary care placement, and that's when I realised I really enjoyed GP. And just talking with other GPs in the practice, talking with students, older students, I decided I wanted to be part of the GP Society. So I signed up to be the welfare officer for third year, and then this year I wanted to do more, so I became the president.
Amazing, that's so great. So what have you gotten involved in this year as president?
Oh, this year we've already had so many successful events. So the first event we had was a revision event for neuroanatomy. That was quite exciting. And then we also had a how to do an audit or a quip within primary care, so that was aimed at third years. We had a GP speed mentoring event, so we had...
That went very well.
It went really well. We had 8 GPs with different special interests come and provide support for all the students, so it was really useful.
Cool. We'll talk a little bit about what special interests are in a minute. Excellent. So when did you first get interested in GP? How did that happen?
So it was just in my third year, so primary care block, and I just thought it was so fascinating that no two patients are the same. You never know what's coming through the door. I just loved it. So it all developed from there, really.
Great. So you've been the president of this society, and I hear that you've had something to do with RCGP as well. Would you mind telling everyone what RCGP is and how you got involved with them?
Sure. So RCGP is the Royal College of General Practitioners. So it's a society of GPs basically, but it actually provides support from even before medical school. So from students considering medicine to medical students to foundation year doctors to trainees and then to GPs. So it really supports you all the way through. And how I got involved was, so I just started sitting in on the RCGP local faculty board meetings, and it was really, really interesting to see what was going on in the locality, and so I became sort of an unofficial student representative of the RCGP Leicester faculty, and through that I've now become a committee member of the RCGP Discover GP planning committee. So that's really exciting.
Right. So what's that all about?
So that is, there are 4 events happening all around the UK, and it's aimed at medical students who are interested in primary care, or even those who are just thinking about it or unsure. And it's full of amazing speakers, and we're going to have really interesting interactive workshops.
So you're involved in the running of this conference now?
Yeah, and the
all
planning.
through just expressing an interest in your local RCGP group.
Exactly.
That's great. So what would your advice be to students who perhaps are really interested in GP but don't necessarily know how to get out there or expand their CV?
Well, I think just being vocal about what you're interested in, talking to GPs, talking to students in your year or in other years, creating a professional Twitter is really useful because it can link you up with GPs who might not be local to you, and just getting involved, getting stuck in and being interested in things.
That's really great advice. Cool.
Thank you.
So also, Jade, if it would be possible to have a little description of a timeline of when you first found out what you really wanted to do, and then how that progressed into being proactive about researching and looking more into the topics that made you interested.
Oh, well, I think it was a very short timeline because so as I said, it started in the third year. And the very first clinic I had, very first video recorded clinic, my very first patient, half an hour, had ADHD, and I had no idea what ADHD was. So that very night I went home and I read up on the topic, and I became really fascinated with it. I started talking to GPs in my practice about it, and through that just provided me with so many opportunities, because one of the GPs in my practice actually had a special interest in child psychiatry, and her husband is a consultant child psychiatrist, so I was able to plan my SSC with him.
That's brilliant. Would you mind talking a little bit about what an SSC is?
Sure. So an SSC is a student selected component that you do at the end of your third year. In any topic that interests you. You can plan your own SSC based on a topic that interests you. So I did mine with CAMS, which wasn't offered.
And CAMS, what's that?
So that's Child and Adolescent Mental Health Services. So I spent 2 weeks with the neurodevelopmental team. So that's ADHD, autistic spectrum disorder, lots of patients with those, and actually both of them together. Crisis team, eating disorders team, learning disabilities. So quite a big range of topics.
Amazing. Yeah. And so you organised this SSC, and have you got anything on the horizon?
Yeah, so I've become super interested in ADHD and ASD now, so I was able to sort of plan my own intercalation project, my own MSc, which I'm planning to do next year. So it's linking ADHD and perspectives within primary care amongst healthcare professionals. So it's perfect for me.
Yeah, definitely sounds perfect for you. That sounds amazing, and all coming from just really being proactive and getting involved in the things that you enjoy. That's really a good message to send out to students. I do have a couple of last final questions for you. First off, what are the main selling points for GP, do you think? Why should students consider it as a career?
So it's really hard to pick a few points, but I think the main one to remember is that GPs are specialists in the person as a whole. So rather than focusing on one organ or one system, they actually consider all the factors that can contribute towards healthcare. So I think that's really important, but also you're an advocate for patients, you become part of the community, you become part of an amazing team, and you know, there's just so many opportunities within GP, and you can choose you have that flexibility within general practice as well. So if you do have a special interest, you can pursue that. You don't have to give up special interests because you're doing GP, not at all. And you have the flexibility, so if you want to do academics, you can continue to do that. If you want to do research, that's fine as well. Or if you have hobbies that you want to pursue, you can do that. Yes. So GP really is flexible.
That's really, really good to hear. If we can pick up on the special interest thing again. So what do you mean by having a special interest as a GP? What does that entail?
Okay, so a GP with special interest, first and foremost, they are still a generalist, but they can have the special interest in a specific topic. So it could be minor surgery, it could be neurodisabilities, it could be mental health in general. So all that involves is obviously completing your GP training, but then doing postgraduate training, and you can just getting involved in courses that are offered or workshops that are offered around the topic, being really up to date with the guidelines, and so patients who present with presenting complaints that are within that special interest,
they'll be sent to you.
They'll be sent to you.
So that's a really good way of having something that you're really passionate in, while still being a GP and following that through. So, for example, you were interested in disabilities. Yeah. So, that's really interesting. I'm not sure everybody knows about that possibility for career. And what do you think are some of the things that put students off becoming a GP?
So I think lots of people might have the misconception that GP is a sort of default career, that if you don't choose to specialise in, I don't know, other specialties, then you just become a GP. But that's absolutely not the case. GP has its own separate training programme, and if anything, it might involve more specialising, because you have to know what's available and all the resources. You have to know about everything, but all the specialties, and keep really up to date with them. So I think that's something that puts people off, but it shouldn't.
Well, I'm sure you've inspired a few people today. And do you have any final comments that you'd like to give?
I just want to encourage anyone who finds something they're passionate in to pursue it. Don't just think that you don't have time to do it or anything like that. Just go with it. And if you're passionate about it, share it with other people, and you never know what that might bring.
Thank you so much, Jade. It's been a pleasure having you on today. I'll let you enjoy your tea now. I won't ask you any more questions. Great. So that's all we've got time for today. Thank you so much for coming and joining us, Jade. It's been really insightful to hear all about the different avenues you can go through in GP, And hopefully you can tune in with us next time with More Than a Medic at Cafe Med. What's it like when you strum it?
Ooh.
I don't know.
No, neither. No.
Just see if it works.
That one works. I think. Yeah. Oh, hey. That was.
Now we're playing the Cafe Med song.
Are we making a song up?
We're making a song up.
No.
What all Cafe Med helps you learn?